Hi, class. I just wanted to tell you some notes about your ADIMEs. They unfortunately were not as good as your first ones, but I just wanted to give you feedback as soon as possible so that you can do better on the midterms and your upcoming ADIMEs. So a few things. If you do multiple goals, you need to have, or if you have multiple PESs, you need a goal for each PES you have. So if you have 3 PESs, you need 3 goals. The goals should be equal and opposite the PES. So if your first PES is unintentional weight loss, your first goal should be prevent further weight loss. If your second PES is inadequate intake B12, your second goal should be increase intake B12 to, and you should say how much. If you don't know how much, for your ADIMEs, you can look it up, but say you're on a test. If you don't know how much, you can say increase B12 to RDA for age. That's totally okay to say. Other things I noticed on the ADIMEs, when you get to your monitoring and evaluation section, you can't monitor something that you didn't have the patient do. So for example, many of you said you wanted to monitor weights and monitor food records, but you didn't actually have the person keep a weight journal or keep a food journal. So if you plan to monitor those things, you have to have a way of measuring them in the first place. Also, a few of you wanted to measure education and knowledge levels, but you didn't educate the patient, so they probably wouldn't have had any improvement of knowledge. B12 and intrinsic factor. We can't diagnose if she has low intrinsic factor without additional testing. It would be a good idea though, and it would be something that I would recommend. If you wrote that she probably has low intrinsic factor, but then you wrote that we should increase her B12 intake from foods, that won't solve the problem of her low intrinsic factor. She would need supplements and or injections. So think about that. Also, when you're going to your monitor and eval and your criteria for the success, look at all the things that were abnormal in your assessment. So client history, labs, anthropometrics, clinical exam, etc., diet intakes, and make sure to follow up on every single one of those abnormal values. So for example, sorry guys. So for example, about 2/3 of you did not say to follow up on red blood cells, hematocrit, hematoglobin, MCV, MCHC, or if you did say to recheck them, you didn't say success if these are within normal range. And that was this person's chief diagnosis was anemia. So we definitely need to address those labs. Also the dentures and the mouth sore, I would have mentioned that somewhere within your ADIME as it definitely affects quality of life and ability to eat foods. Speaking of the dentures and the mouth sore, when some of you guys did recommend dietary changes for this person, multiple people recommended nuts or tough meats. I don't think she'll be able to chew those with her poor fitting dentures and mouth sore. Also, the meats require cooking, and generally meats and nuts are actually quite expensive, and she's not motivated to cook. So you got to think about things that will work for this specific patient. Other things, protein needs for a 100-pound, 73-year-old sedentary woman. I would give her more than the RDA, but I would probably not give her more than a endurance athlete. So some people gave her only the RDA based on her current weight, which remember her current weight is below goal. So if you only give her the RDA of her current weight, that won't sustain her at her future weight. But if you gave her much, much more, although it's not wrong, it's probably not ideal. She doesn't probably need 1.8 grams per kilo protein because she's just sitting there doing nothing. It won't hurt her, but it may be easier for her to get intakes from other food sources. Make sure your percentages of calories from the different things add to 100. PES statements again. So with the P's, make sure the as evidenced by part is the evidence of the P. So if I say unintentional weight loss as related to depression, loss of income, low motivation to cook, limited access to food. Then I'm going to say, as evidenced by weight loss 8 pounds 2 months, 7% weight loss, severe, and percent usual body weight. That is the evidence that she's lost weight, not anything else. As far as the percent ideal body weight is not proof that she's lost weight. She may just be a petite person. So that's not proof that she's lost weight. But make sure that your evidence is proof of the problem, not proof of the cause. Be specific on everything. So goals, PES statements, etc. State numbers, state percentages instead of stating low or high. Don't say like low protein intake, say protein intake 63% of goal, or low fruit intake, say only 1 serving of fruit, things like that. Because if you state the numbers, then with our interventions, we can measure that we've changed those numbers. Other things, so with this particular person, we did know that she was not eating enough B12 because we looked up the animal source of protein, the milk, it did not have enough. I told you that in class. So we do know that. However, since we didn't analyze the diet fuller, we're not sure if she also has low intakes of folate and thiamine. And so you needed to mention those as other possible causes of the anemia, because we haven't ruled them out. And many people forgot to mention those or note for any follow-up to assess those levels, etc. So you should probably mention those. Stop restricting sodium. A lot of you guys put her on a sodium restriction. I almost never put elderly on a sodium restriction unless they absolutely medically need to be on a sodium restriction. This woman has no evidence of heart disease. She's lost weight. She doesn't even like eating or cooking or anything. So I definitely would not restrict her foods more than possible, or more than you have to, which is you don't have to. You have to give her more food, not less. I don't care if she eats ice cream. It's got B12. Anyways, another thing, a lot of you guys had her goals for weight to be at her ideal body weight, not her usual. And so if you're going to have a person get to their ideal that's different than their usual, you need to say why. So for example, I am not at my ideal body weight. I am if you look at the range, but if you just gave me one number, I'm not at my ideal body weight. But if somebody says, oh, you're not at your ideal body weight, you need to go gain 10 pounds, I'd be like, why do I need to gain 10 pounds? Like, I'm healthy, I have good musculature, I have good fat, like I have energy, I eat right. Like, why should I just go gain 10 pounds to be at this number? So if you think she should gain more than her usual, you need to say why. I did have one student say why, and that student said that higher BMI could be protective in aging, which is very true. So critical thinking through this whole process. Other things, sign and date and credentials. A lot of people forgot to do that. And yeah, use the grading rubrics. A few people did still miss points just literally because I think they didn't use the grading rubric. So use the grading rubric. I highly recommend coming to my office for help with these things. This class, because our limited lab time, you need extra time outside of class. So you need to practice, come ask me for help, etc. Other things coming up. So we have our lab midterm coming up. And for the lab midterm, the things that you will be given this diagnosis sheet. You will be given the tube feeding sheet that looks like that. You will be given these charts for the MAMA TSF, but you have to know the equations and how to do them. And you will be given Mifflin St. Jour, normal lab values, and I probably could give you like Livingston and WHO as well. So these are the normal lab values you get. You definitely need to know how to do a tube feeding, both bolus and continuous, how to select a tube. You need to determine the right formula for tube feeding and tell me why you selected that. You have to be able to calculate people's energy and protein needs. I highly recommend maybe you review my list on my little Excel thing for protein needs, or look them up in some of your texts. I think I read them to you at the beginning of class. I don't have a Word document on them, but remember, 0.8 is the RDA, 1.2 to 1.7 is for most athletes. It is recommended to have some extra protein with aging. Critical care patients, 1.2 to 2 grams per kilo. Burns, probably 2 grams per kilo or more, etc. But be kind of reasonable with your protein intakes. Although there is a wide range of technically correct answers, there's answers that are a lot better than others. So you will have to calculate energy needs, protein needs, carb needs, fluid needs, fat needs. You're definitely going to have to analyze a diet for quality and quantity. And I really want to stress the quality part, because a lot of you guys are missing the quality part. The quality part is, do they meet all the food groups? Literally go through them and tell me, no, they didn't meet their veggies. They only ate one. They only ate one dairy. They only ate one protein food, blah, blah, blah. Tell me that. Then look at like what types of nutrients they're eating. Are they eating simple sugars? Are they eating whole grains? Are they eating processed cans? Foods with added sodium or foods with added fat, like fried foods? Are they eating out? Are they getting essential fatty acids? Are they getting fiber? Are they getting fluid? Are they getting colorful fruits and veggies? Look at all those quantities or qualities of and quantities of the food. So you're going to have to do that. You will do a 24-hour recall. You won't have the book. I recommend for the test splashing down that grid that's in your lab where it talks about like the different foods and how many calories, grams of fat, protein, etc. are in them all. And remember the patterns with the fat, the 8-5-3-0. So I recommend splashing that down at the beginning of your test, as well as maybe some other formulas that you're trying to remember. So you do need the formulas to calculate MCV, MCHC. You're not going to get those. You need formulas for MAMA, and you need to know how to interpret MAMA, TSF, MCHC, MCV, and all of the anthropometrics. So waist to hip, percent ideal body weight, percent weight loss, percent usual body weight, BMI, etc. The labs, the only one you have to know is albumin for now. What else would I say? I think, other things for the test, you will have to write all or part of an ADIME. So be prepared to know what goes into the ADIME and be prepared to write that. The test will take you 3 hours almost for everybody. Bring a pencil, bring a calculator, bring snacks, bring coffee, whatever. But the more you practice, the faster you can get at these things before the test. And that's just really crucial. So I do want you to do your best. I don't want to be mean to you with my grading. I just want you guys to do your best and understand the process. I'm here on my Friday, which is my day off, so I could get you guys your labs now instead of Monday, so you could study for them. And I'm making you guys this video with my crazy hair. So anyways, do your best to study. I think I covered a lot of what's on the exam, but on Tuesday, if you guys have questions for me, you can ask me. If you want me to review your ADIMEs and try to get those back to you before the exam, the earlier you bring them to me, the better. Hope you guys have a good weekend. You better study the whole weekend. No, just kidding. Okay, bye. That's all.